Welcome to Module 4, a video on hand hygiene. My name's Priscilla Makazi, pediatric nurse working at Kilifi County Referral Hospital and the focal person on infection prevention and control. The objective of this video is to demonstrate proper hand hygiene to avoid the spread of infection. It is very important that every healthcare professional follow hand hygiene protocols both in the workplace and at home to prevent the spread of COVID-19. Hand hygiene can be the single most effective method to break the chain of transmission. Hand hygiene can be done with soap and water or with alcohol-based hand rub. The alcohol hand-based must have a minimum of 70% alcohol for effectiveness. Hand wash with soap and running water when visibly dirty, visibly soiled with blood, body fluids, or others dirty, e.g. glove, powder, and after using the toilet. Use an alcohol-based hand rub if hands are not visibly soiled. Routine hand asepsis in all other clinical situations. If alcohol-based hand rub is not obtainable, wash hands with soap and running water. We are going to look at the hand washing steps indicated with soap by the World Health Organization. We are going to have a hand washing demonstration, and these are the steps to follow. Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Put the right palm over left with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in the right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands with water. Dry hands thoroughly. Use towel to turn off faucet. Your hands are now safe with a single-use towel. Wash your hands for at least 20 seconds. We are now going to look at the hand hygiene steps with alcohol-based hand rub indicated by the World Health Organization. We'll have a demonstration, and these are the steps. Clean your hands by rubbing them with alcohol-based hand rub as the preferred means for routine hygienic and antisepsis if hands are not visibly soiled. It is faster, more effective, and better tolerated by your hands than washing with soap and water. I'm going to demonstrate the steps for cleaning your hands with alcohol-based sanitizer. These are the steps to follow. Apply a palmful of the product in a cupped hand, covering all surfaces. Rub hands palm to palm. Right palm over left with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are safe. Remember to do this process for at least 20 seconds. As per the World Health Organization guidelines, there are 5 moments for hand hygiene that you should practice. Before touching a patient, before clean and aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surroundings. This frequency is important because it protects patient from transfer of infections from other patients and or environment. Protect risk of procedure contamination by healthcare workers' hands. Protect healthcare workers from body fluids contamination. Protect other patients, self and environment from contamination. Reduce risk of self, environment, and other patients' contamination. It is critical to avoid prolonged hand contamination by using the appropriate technique, using an adequate quantity of the product, either the rub or soap, covering all skin surfaces. Washing and rubbing hands for the recommended length of time. Hand washing is important for everyone, regardless of their role.